Hi, my name is Hilary Baldwin. I run the Acne Treatment and Research Center in Brooklyn, New York, and I spoke at the AAD in San Diego a couple of days ago, and I had two sessions. The first was on spironolactone, and the second was what's new in the treatment of acne. So let's start with spironolactone because that was actually kind of interesting. There's a whole 2-hour discussion on spironolactone, why we use it, mechanism of action, side effects, data behind it, as well as patient selection. And other than the fact that the topic is interesting, what I found very interesting is that it was a fairly large room, very, very full. The overflow room was full, and they needed an overflow from the overflow. So evidently, people are very interested in the use of spironolactone for acne, and I think they should be because it's an amazing drug. So we talked about patient selection, and patient selection is very easy. Anybody with acne who happens to be female and over the age of, let's say, about 15. We want our patients to already have established their menstrual cycle for about a year before we start it. Otherwise, it works very well for everyone. You know, we know that there is no such thing really as hormonal acne, right? All acne is hormonal. So it's effective for everybody, except for men. Men is being male is my number one contraindication to the use of spironolactone. It has been used in men. We even have an acne study in which it was used in men. But very shortly after starting the study, the men were discontinued. 3 of them developed gynecomastia and they stopped the study and went forward with the women only. So it's not a drug for the treatment of men. It's not to be used during pregnancy. It also takes a long time to work. So if a patient walks into your office and says, I'm getting married in a month, this is not the drug for her. And those are really the only contraindications that I see to this drug. It's very safe, very easy to use. Most of us start with about 50 to 100 milligrams a day. And at that point, we see very few side effects, which are mostly nuisance side effects. They're not scary side effects, right? They're menstrual irregularities and maybe some breast tenderness. Very few people feel dizzy or lightheaded. Postural hypotension just isn't seen with this drug, even though it's a drug that's FDA approved for the treatment of hypertension. It is important to remember that this is not FDA approved for the treatment of acne, but standard of care in the United States is certainly for its use in all androgen-related disorders, acne, hirsutism, and alopecia.